I am a neurosurgeon and a spine surgeon who specializes in advanced spinal care and treatment. Spondylosis is one of the spine conditions which bothers a large number of people. Back in the old days, this was seen mostly in elderly people as an aging process. But these days, many youngsters in their 30s and 40s are affected by this spondylosis, and it makes their life miserable, especially for desk job people. What is spondylosis? How it affects your spine? What are the symptoms and how to treat? Let's discuss in this video. Stay till the end, friends. I will give you my top 5 tips for home remedy in spondylosis. Hello and welcome. This is Dr. Arun Naik from DocLogs channel, helping you to have dialogues with your doctor. I am a neurosurgeon and a health blogger. If you are new to the channel, please consider hitting that subscribe button. That said, let's have a doclog. Spondylosis is a general term for many age-related wear and tear affecting the backbones. It can happen anywhere in the backbone. When it happens in the neck, it's called a cervical spondylosis. And when it happens in the low back, we call it a lumbar spondylosis. When we get aged, our discs dehydrate and shrink. Signs of osteoarthritis develop, including those bony spurs along the edges of the bones, which are called as osteophytes. Generally, when used alone, spondylosis means neck problem, that is cervical spondylosis. Cervical spondylosis is very common and worsens with age. More than 80% of people older than the age of 60 are affected by cervical spondylosis. Most people have no symptoms from these problems. Now, what are the symptoms of spondylosis? For most people, spondylosis causes no symptoms. It's just an aging process like cataract or arthritis or knee joint pain. When symptoms do occur, they typically include pain and stiffness in the neck and the back. Sometimes an advanced spondylosis leads to narrowing of the space needed by the spinal cord called canal. So this spinal canal houses your spinal cord and those precious nerve roots that pass through the spine to the rest of your body. If the spinal cord or these nerve roots become pinched, you might experience tingling, numbness, and probably weakness in your arms, hands, legs, or feet. Lack of coordination and difficulty in walking, and in the neglected advanced stages, you can have loss of bowel and bladder control with the resultant incontinence. Now, when to see a doctor? Friends, seek medical attention if you notice a sudden onset of numbness or weakness or loss of your bladder or bowel control. Fine motor control like writing or holding objects in the hands or holding the footwear in your toes. These are the danger signs of spondylosis. Usually when these symptoms last more than 3 weeks without any reason, you have to seek medical attention. So what causes this spondylosis? As I already told you, as we age, the bones and the cartilage that make up the backbone and the neck gradually develop wear and tear. There are 4 causes for spondylosis. In any given patient, one or more of these can cause pain. Number 1, dehydrated discs. As I already told, discs act like cushions between the vertebrae or the backbone. By the age of 40, these spinal discs begin drying and shrinking, which causes bone-on-bone contact between the vertebrae, causing severe pain. Number 2, herniated discs. Age also affects the outer part of your spinal discs. Crack do appear, leading to bulging or herniated discs, which can press on the spinal cord and nerve roots. Number 3, bone spurs or bony spurs. Disc degeneration often results in the spine producing that extra amounts of bone growth in a desperate effort to strengthen the backbone by the body. These bone spurs can sometimes pinch the spinal cord and nerve roots. These spurs are also called as osteophytes. Number 4 and the last is the stiff ligaments. Ligaments, friends, are those cords of tissues that connect bone to bone in the body. Spinal ligaments can stiffen with age, making your neck and body less flexible. Now, who are at risk of developing spondylosis? Firstly, obviously, advancing age is the commonest cause. Occupations that involve repetitive neck movements, awkward positioning, or a lot of overhead work put that extra stress on your neck. I see these days a lot of IT professionals coming to me with symptoms of spondylosis very early in life. That is very, very miserable. At their late 20s, in 30s, they come to me with this disabling neck pain and back pain. Most of these are because of the bad posture. How bad posture affects our backbone? See a separate video in DocLogs. Secondly, previous neck injuries appear to increase the risk of developing spondylosis. Thirdly, there is some genetic connection as well. Some individuals in certain families will experience more of these changes over time, while others will not. Fourth and the most important factor is smoking. Yes, smoking has been linked to increased neck pain and back pain and eventually to spondylosis. Smoking causes those tiny blood vessels to get blocked, and these blocked blood vessels will stop the supply of blood to the vertebrae or the backbone, and the backbone degenerates. Watch DocLogs to know how exactly smoking affects your backbone and neck bone. Now, what are the symptoms of spondylosis? To start with, the signs and symptoms may be too subtle to take note. There will be that typical neck pain, back pain, and stiffness. Pain in the neck can radiate to one or both upper extremities. This pain may be associated with troubling tingling numbness or pins and needle sensation in the arm, forearm, and hands. Feeling like insects crawling over your skin will be difficult to miss. One of the striking symptoms which I often see in such patients is reduced fine motor skills, especially in fingers. As I already mentioned, it may become more difficult to write, button a shirt, or eat with a spoon. Next symptom is changes in gait or walking. Walking may be unsteady or the legs could feel heavy. Many of my patients keep falling and break their backbones. Never neglect imbalance while walking if you have neck pain or back pain, friends. Weakness of the arms or the legs may also occur in the later stages. Keep a watch on your fine motor power. Last symptom not to miss is loss of urinary and bowel control. This is definitely a grave symptom, friends, and the last symptom before someone becomes bedridden. Now, how to diagnose spondylosis? When such a patient comes to me, I start with a detailed physical and neurological exam so that I can pinpoint the issue. Next, I ask for a neck X-ray, which can show some abnormalities like bony spurs that indicate cervical spondylosis or lumbar spondylosis. X-ray can also rule out rare and more serious causes of neck pain and stiffness, such as tumors, infections, or fractures. However, investigation of choice in spondylosis is MRI scan, which can help pinpoint areas of the backbone where nerves might get pinched. I may also order nerve conduction study. Here, the electrodes are attached to your skin above the nerve to be studied. A small electrical shock is passed through the nerve to measure the strength and speed of nerve signals. Now, how to treat spondylosis? Treatment of spondylosis depends on the severity of your signs and symptoms. The idea is to relieve your pain help you maintain your daily activities as much as possible and prevent further permanent injury to the spinal cord and nerves. First line of treatment in my practice is always medications. Many of my patients would have tried over-the-counter painkiller medications. I start them on non-steroidal anti-inflammatory drugs and few other neuropathic drugs. Sometimes a short course of oral steroids might help ease pain. Muscle relaxant can help relieve muscle spasms in the backbone. Neuropathic agents can blunt the pain of damaged nerves. I may also start antidepressants to help ease the neck pain. Next, I will refer my patients to a physical therapist who can teach them exercises to help stretch and strengthen the muscles. Some patients with cervical spondylosis benefit from the use of intermittent traction which is applied to the neck, which can help provide more space within the spinal bones if nerve roots are being pinched. When all these measures fail, I may consider surgery in some patients. Out of maybe 100 patients who come to me, I advise surgery maybe only in those 5 patients where the symptoms are worsening day by day and when they have neurological symptoms and neurological signs, which means if you delay, then there will be permanent neurological damage. If conservative treatment fails, or if your neurological signs and symptoms such as weakness in the arms or legs worsen, you might need surgery, as I said, to create more room for your spinal cord and nerve roots. Various types of procedures are done in these cases. Surgery may involve removing a herniated disc or bony spurs, sometimes removing a part of the vertebra or fusing a segment of the backbone using bone graft and some other hardware. Now friends, as I promised you, my top 5 home remedy tips for spondylosis. Number 1, heat and ice treatments. Some people with spondylosis benefit from using heat or ice for their neck pain and back pain. Regarding whether heat application or ice application, my practice is to advise heat and ice application on alternative days. It works that way for my patients. You can apply heat or ice pads to your back for 15 minutes, maybe 2 to 3 times a day. Number 2, consume an anti-inflammatory diet. Friends, making changes in your diet may have an impact on your spondylosis. Yes, consuming an anti-inflammatory diet decreases the joint inflammation and relieves pain. The Mediterranean diet is often advised for people with spondylosis. This diet, as you know, is high in fresh fruit, vegetables, fish, legumes, and red wine or chocolate. This has been linked to decreased joint inflammation and improved mobility. Watch DocLogs to know what are those 7 superfoods for people with back pain. Avoid pro-inflammatory diet of pre-packaged foods, sugary drinks, those junk foods, and yes, that red meat. Number 3, meditation. Many of my patients tell me that regular practicing of meditation and yoga benefits them a lot in the long run. Number 4, spinal braces. That neck collar or lumbar brace will rest your inflamed backbone and gives comfort. Avoid these braces for more than 4 weeks, which may cause muscle atrophy and increase your pain. Number 5, most important of my tip number 5 is maintain a good posture. As I already told in this video, good posture definitely makes a difference in your pain. With that friends, we have come to the end of this video. Thanks for watching and hope you found this video helpful. If you liked it, give me a big thumbs up. Share this video with your near and dear ones to put them also on the positive side of their health. If you're new here, please consider hitting that subscribe button. Also, hit that bell icon to get instant notifications of my new videos as I upload. Friends, if any one of you or your family members ever had spondylosis, whether it is cervical or lumbar, please put your thoughts in the comment section below. What were the symptoms? How was the relief? And what you did special to get rid of your pain? Let's discuss this further. Friends, I'll be back with another equally interesting doc log very soon. Till then, feel awesome, live awesome, and take good care of your health.